Hello again. Welcome back to the Better Together podcast. I'm Mike Baker, your host. We are so excited that you're here today. We have another great episode. Today, we get to talk with Lieutenant Jeffree Boyd with the Salvation Army Kroc Center here in Coeur d'Alene. The Kroc Center is a gem for our community. Many of you have been there. You've had birthday parties there. You've gone swimming. You might have utilized the resources that they provide. The Kroc Center is amazing. Today's conversation, we're going to talk a little bit about how Lieutenant Boyd got here in the community. Him and his wife, Kristen, are the executive directors at the Kroc Center. A little bit of their journey coming to Coeur d'Alene. Talk about what the Kroc Center does, what the Salvation Army is all about. And then we touch on the things that are really close to my heart, the connection between health and fitness and nutrition, and really caring for the whole person, the mind, body, soul. We talk a little bit about the amazing Kroc RX program we had and some really fun things as we go through this. So I know you're going to enjoy this episode. Let's get into it. Well, welcome. Thank you for being here, Jeff. I'm excited for this conversation. Our organizations have a long history together. We've done lots of projects together, and the theme of the podcast is all about better together, which is amazing. You've been here for about 8 months now in the community. This is incredible. Let's talk about your journey through Salvation Army to here in Coeur d'Alene, and then we'll talk a little bit about the Kroc Center and what the Salvation Army does.
Sure. Well, my wife and I were appointed to the Kroc Center here. It was in July of last summer, and we had been introduced to the Kroc Center about 6 years prior during COVID. We had visited that location, and we fell in love with the city. We fell in love with the Kroc Center and the ministry happening there, and we prayed that one day we'd get sent here. And not all prayers get answered, but this one did. So coming here was an answer to prayer. The way the Salvation Army works, they appoint officers to the different locations to oversee them. So my wife and I are the executive directors here. And prior to that, we're at their university getting trained for it. Our first career was in residential real estate, so we were down in Southern California. And we spent about 15 years in that. Had a lot of success, but at one point we decided, in our minds at least, to trade success for significance. I kind of looked up the ladder of success, and there's no end. There's always someone doing a little bit better than you. And I also understand and believe that life is short, and so do something meaningful. And so my wife and I felt that calling to go into that full-time ministry. I grew up in the Salvation Army. I'm a fifth-generation Salvation Army officer. My whole family is involved in the Salvation Army. My wife actually came to the Salvation Army through youth programming down in Southern California, so she's a first generation. So certainly no strangers to the Salvation Army and the work they do. And so when we got that calling to go into full-time ministry and full-time nonprofit, it was no question that it would be with the Salvation Army. And with the Salvation Army, you don't get to choose where you go. They send you to any one of their locations. Like up here in the Northwest, there's 33 Salvation Army locations. The Kroc Center obviously being the best of all of them. And we made that prayer. So we're really fortunate to be here for this season. And you've met the other directors over the years, and so you know that we're not here forever. But we're hoping to be here for at least the next 8 or 9 years.
Oh, it's amazing. And we're so glad to have you in the community. And while it's sad to lose directors, it has been so much fun to get to know so many different people over the years and see the different impact that each of them have. And I'm sure, that falls into the mission of Salvation Army. You're bringing different talents into each place that at the time that it needs it, which is a wonderful thing. You guys have family?
Yeah, we got 4 kids. So we got 3 high schoolers over at Lake City High and an elementary over at Skyway Elementary. So tough on the kids to make that move. but we couldn't ask for a better place for them to finish out high school and
Yeah.
to finish out. Hopefully, if we're here long enough, then all of our kids will be through the high school system here.
That's great. My kids went to Skyway in Lake City, and I guess we should say congratulations to the Lake City basketball team. They just won the championship, so that's pretty exciting. How are you guys settling into the community? What's your favorite thing to do on the weekends when you're here in Coeur d'Alene?
Well, I just spent the last 16 weeks prepping for a 39-mile run. So
Oh,
just
beautiful.
turned 39. And what better way to commemorate a birthday than run your age?
That's amazing. Nice
But
work.
my main sport would be mountain biking.
Beautiful.
And so what a wonderful place. I mean, you got Canfield right here, 10 minutes from anywhere. And then, you go east and you're at Silver Mountain, and you go north, you're at Schweitzer. So love getting into all the different trails that are nearby. So mountain biking and this area, they just go together like peanut butter and jelly. So excited to even explore some new trails. But that's what I love doing on the weekends. And then working out at the Kroc Center, love lifting weights and between that and mountain biking. But I know there's a history of triathlons here.
Keeps you going. I know.
And
That's
I
right.
work
was
at a
just
place
gonna
that's
get
got
there.
a nice pool. So that's the one discipline I don't know yet. So what better place to learn? So in the next couple of weeks, I'm going to be taking some swim lessons at the Kroc Center.
Beautiful. That's
and
great.
sign up for that triathlon coming up in August.
Awesome. I did the last half of my swim in the Ironman floating on my back. It happened to be a beautiful day. I was looking at the sun. It was the most peaceful, beautiful part of the Ironman experience for me.
Yeah, that's wonderful. I'm going to start with an Olympic, and we'll see where it
That's
goes
great.
from there.
No, it's a great thing to do. It's fun. For me, the most inspiring moments of the triathlon are that 11:30 to midnight timeline. That's more my people. I was like, yeah, the pros, they finish
Yeah.
in 2 hours, and they're like, yeah, we're great. I'm like, we want the full experience.
Yeah.
But you watch the finish line at the end of any race like that, but especially a full Ironman. I mean, you realize that there's no excuse for you not to be out there doing that. You see people walking there with one leg, and people that just have, you would look at them and go, there's no business running that, and they're just smiling, finishing the experience. It's incredible. And I think that, back to the work that the Kroc Center does, I mean, it's providing that experience for the community to come together around a better outlook for life. And you obviously know the importance of physical fitness and increasing that physical activity. That's an amazing thing. So we'll talk about some of the health benefits and what that looks like in just a second, but let's talk about the Salvation Army. So you mentioned a lot of people know the Kroc Center.
Yes.
They might not know the first part of it, the Salvation Army side of it. Let's talk about what the Salvation Army does, the global impact, and then we'll kind of come back into Coeur d'Alene and how we work together.
It's funny, walking around the Kroc Center, sometimes people ask, what's the association with the Salvation Army? Do they rent space here? Because they just know of the Kroc Center. But the reality is the Salvation Army has been present here in Coeur d'Alene since 1907, doing social work and social services. So I can pull up newspaper articles where they're doing community meals and community feedings. So always been involved in that social work. The Salvation Army started in 1865 in London, England by William Booth. And he saw the depravity of alcoholism and how rampant that was. And he said, I got to do something about this. And so he started basically rehab centers, and they were refurbishing items, kind of like what you see with thrift stores. Mm-hmm. And when they sold those items, that funded the rehab. And these people got saved through that process because we are a Christian nonprofit. But there was no church for them to go to. And so he had to make a church because these people, while they were now sober, they weren't necessarily the level of caliber that the churches would receive. And so they started a church at that point moving forward. So all the Salvation Army locations have a church a part of it, and we are a faith-based organization. We're actually in 144 countries in the world, and so when someone's local, all they care about is what's local.
Yeah.
But it's good to know that you're part of something that far reaches. I mean, 144 countries in the world is amazing. And in everywhere they are, they're serving the needs of that community. So the programming in Kenya is going to look different than the programming in parts of Australia. So the Salvation Army does a needs analysis of each community, sees what the needs are, and then they go and they seek to fill those needs, along with the help of community partners. Because honestly, we couldn't do this on our own, mm-hmm. right? We are a nonprofit, and so it takes community support and community collaboration with companies like yourself. And so while the Salvation Army was here since 1907, it's changed over the years. It's morphed. It's always been seeking to help us kind of suffering humanity and people that need a hand up. And when the Kroc Center came here. There's 7 Kroc Centers in the Western United States. There's 25 in the United States, and so it was started by Ray and Joan Kroc. They funded one in San Diego, and so they were told that if they were going to fund a community center, and they asked which company should we partner with, and the mayor at that time said you need to partner with the Salvation Army. So Joan Kroc funded the first Kroc Center down in San Diego. And it was so successful, she said, let's build the 25 more of these.
So cool.
And so we were one of the, I think the third Kroc Center to get appointed. And most of them you'll see in major metropolitan areas. The Salvation Army is generally downtown somewhere because that's where the needs are honestly the greatest. But I think what we've seen here in Coeur d'Alene is there wasn't a community center, you know? And by virtue of that, we have the highest membership in the nation. You know, in a town of 56,000, a metro area of about 200,000, we have the highest membership. It flexes somewhere between 17,000 and 19,000 members. The average Kroc Center has about 5,000 members or so. And it shows you what a community center can have an impact when there's nothing else like that in that community. In San Diego, you might be one of several, but here, we're the only real community center in town. And so it's been a wonderful expression of what the Salvation Army does. But it's certainly worth pointing out that we've been here. You know, we've been here since 1907, and I think sometimes that get lost on the story of when the Kroc Center came here. But I would say this is probably the best expression of the Salvation Army.
Yeah, see, it's like the 2.0. You know, that's the story everybody knows. For us, you know, we've been around for about 40 years, and you know, there are people that they remember us as the volunteer clinic. You know what that looked like versus now we have our Center for Healthy Living, and I mean those two worlds look very different. And starting to shift that, and I think that progress and growth. One of the things that we have loved in this community, and we've talked about it many times in meetings, is the sense of home and the feeling that you get when you walk into that. And when we were designing the Center for Healthy Living, we talked about we want it to feel like the Kroc Center. We want you to walk in and just have that feeling of love and acceptance and peace and calm. One of my favorite places, is just sitting in the area there by the fireplace and, having a coffee and there's just something peaceful about it. And then people watching and seeing everybody walking through the doors. You got people dropping off their kids and coming in to work out. And it's just that moment of respite for the community. So you guys have done such a great job fostering that feeling and being part of the community. And then the origin story, I wasn't here yet when all of the fundraising was happening. But so many people in this community stepped up to make this thing happen. And I just, back to the Better Together of the podcast name, it's just like, this is such a great example of what we can accomplish when we work together to shape our community. That's great. Is there anything else you want to say about the Salvation Army, Kroc Center, before we jump into some kind of healthcare stuff?
No, it just it's a blessing to be supported and embraced by the community so much, and while we can talk about what the Salvation Army is doing on a global scale, I think when you're sitting here in Coeur d'Alene, or Hayden or Rathdrum, your concern is how is this benefiting my community? How is this center giving back? And so I love that we're going to get into that today.
That's great. Well, one of the really amazing experiences that we had as an organization collaborating with the Kroc Center was a program called the Kroc RX Program.
Yes.
And it was fascinating to watch. Dr. Abate was our medical director at the time. And this guy has just a heart of gold. You may have met him. He's there at the Kroc Center a lot. Him and Kip and a guy named Bill Davenport had this idea of could we think about healthcare differently? And so taking patients out of the clinic, bringing them to the Kroc Center. A lot of times they happened in the party room. And so we had, 10 or 15 patients in there learning about how to improve their physical fitness, how to eat better. That part was amazing, but the coolest part was that you had people in a group learning together and just bonding and building relationships. And the providers had such an incredible experience being out of the office and then thinking about healthcare in a different space. When you guys look at the mission of the Salvation Army and the swimming safety, the physical fitness, the other supportive programs that you offer. How do you see your work contributing to the community, to kind of that overall wellness side of what our community needs?
Absolutely. You touched on it right there. Community needs. We're always assessing what are the community needs because every community is different. And in this community, mental health and drownings, those are two big targets. And there's a lot of people that are involved in mental health. And we certainly aim not to duplicate services. An example of that would be the Salvation Army is always involved in feeding. So whether that's food for homeless or if it's food for families that are experiencing food insecurity. But there's already 6 other food banks in the area. So rather than duplicating efforts and having our own food bank, the majority of Salvation Armies have what's called a hope market, where people come in and they shop for the groceries they need. But rather than duplicating something that's already, there's 6 of them in the area, we do our food drives and our annual fundraisers to support those 6 different food banks. And so knowing that there was already agencies covering those types of services, we decided let's not step into that. Let's support those. So we'll still do the food drives. We have such a large membership. Why not? Why not leverage that membership to get food into the food banks that are maybe running low on their supplies? But drowning was a big thing, so the state of Idaho, and then especially in this area, epidemic, if you want to call it. And so coming up with that 3rd grade swim, we're the only Kroc Center that has that program.
Oh, very cool.
And so we're actually knee deep in that program right now. So if you're a 3rd grader, your week will come where you get to come Monday through Thursday and you get to learn to swim. I mean, there's so many people, the story about a drowning in the family or a near-death experience with drownings. And then mental health, it's a hard one to tackle. And so we provide vouchers for those that don't have insurance. And we have 6 different providers in the area that we work with. So sometimes we refer to providers, or sometimes providers come to us and say, look, I got this family. They're in crisis right now, but they don't have insurance. And we know that if they can get their first 8 to 12 sessions, we can get them out of crisis, right? Get them out of that crisis moment. The part of the mental health that we try to really lean into is teen suicide. So, I think we're Idaho's number 4 in the nation, but this area right here, we're number 1 in Idaho.
It's really rough, yeah.
For 1 in 10 high schoolers will attempt suicide. I mean, that number just breaks your heart.
Yeah.
And what can we do about that? If that is our epidemic in this city, right? Other cities have homelessness. Like, we don't have that. Our last point in time study for this city was like 71.
Yeah.
Right? So that's not our epidemic, right?
Yeah.
But if mental health and specifically suicide among teens, what can we do about that? So we started a program called MAC, Mental Health Awareness Club, and then we do vouchers for families that lack insurance. And so again, stepping into what are the community needs and how can we come and fill those needs? And if we can't fill them on ourselves, who can we partner within the community, whether it's providing space for them to run their program through our facility or if it's going to them. One of our programs we've taken out to the field is Mobile Kroc. So in the Mobile Kroc, we go into elementary schools and we provide structured playtime in the recess. And we've seen a 64% reduction in behavioral, in bad behavior in these schools. And we can't cover every school, but we've inspired other churches and other organizations to say, look, I'd like to do what you're doing. So we come alongside them and we teach them for a couple months, and then they take that on and they adopt that school. So while we can't cover every school, we can come along other partners, inspire them to do the same kind of work.
What a cool program. That's great. I had heard about that early on, and I don't know if you do hockey in there yet, but that's my sport. So always, people turn out to be very well-adjusted people when they play hockey.
There you
go. Watching the community grow and increase that physical fitness and then that focus on the mental health. I remember talking to you guys about the mental health, the MAC.
Yes.
Yep. And just how kids are accessing that. Let's talk about that just a little bit, because I love how it's set up and structured.
Sure.
And how you've got people just kind of available and watching for somebody that needs help. And
sure.
I mean, I know you've had a couple of really good success stories through that. Something maybe we can highlight.
Yeah, so we have one provider that is currently on site, and we're in a transition from the MAC program into starting another one similar to it. One of our providers has gone on to some other ventures, and so we're in the process of kind of rebooting it. It's always good to stop and pause and say, how is this program running?
Right.
How can we improve it? What are the next steps? But basically, it was a after-school program for middle schoolers, and while they can process their emotions and what they're going through in life in a safe environment. And then we have kind of wraparound programming before and after, so that they can continue to stay at the Kroc and get into other programs as well. And so that one is specifically middle school, and we're looking to see, is this something we should also be doing for high schoolers? People need a safe place to belong.
Right.
And the Kroc Center certainly has become known as that. It's one of our core values, a safe place to belong and grow. And so while we're in the process of transitioning, that is a program that we will be rebooting here shortly.
Oh, it's great. I mean, anything we can do to, be available for kids. We just, previous episode, we had Rosa Metler from Canopy Village on and talked about, all of the resources that they have to offer to support families. And, I think we're so blessed to have these resources in our community and different places where if home is not that safe place for you, that you do have a place where you can go and feel welcome and accepted and supported. I mean, that's such a incredible need in our society today when everything is so divisive and polarized and just difficult. It's like just go and have a place to take a breath and decompress. So
Absolutely.
yeah.
We love partnering with the different communities. We have one council we recently joined called the Greater Love Council, and it's basically a collection of the nonprofits. And the idea is to get together and network and figure out what services can we, not duplicate on, but what resources does Canopy have that we can refer to,
Right.
and vice versa. How can we come alongside them? And so we're having these conversations. And then Charity Reimagined.
Yeah,
right?
it's such a great program.
Absolutely. How can we move somebody from the resources that the Kroc has over to Canopy Village, and how can we have a warm transfer? Because I think there's a lot of good nonprofits doing good work, but sometimes we operate in silos. And so our goal is to be that community hub, and maybe we don't have that resource, but we know who does have that resource, and so we can pass them on.
Yeah, it's that Rolodex that we all have for our community. It's like, how can you help? And we talked about the impact of case managers at Canopy Village, and I mean, we have them. I know you guys have people that operate in those roles. I mean, those people are just magic, amazing heroes in our community because they know where to go. We have our crisis managers here at the Center for Healthy Living, and I know they've worked with you guys before. And it's like these people just know how to connect people to the most obscure resources because they just have been through everything, and it's amazing. I mean, our community, like we have so many things. Sometimes there's the stigma of asking for help. How do you guys address that within the Salvation Army or the Kroc Center? Tie those together. What we have in Coeur d'Alene. How do you approach helping people just feel welcome and loved, and kind of addressing the stigma of asking for help?
So you'll hear a term. I don't think we coined it, but it's called charity with dignity. And so we might have somebody that needs clothing. Clothing is one of our programs. We have a Clothe a Child program. Rather than doing a one-day event where we bring a couple hundred people together, there's not a lot of dignity in a parent coming there for a big PR event.
Yeah.
We said, well, how can we make this more of a dignified experience? And so now it's a one-on-one. So a single mother signs up because maybe it's the end of summer and they don't have the winter wardrobe and their kids are growing, they're in high school. I'll point out that we do high schoolers too, because usually a lot of these clothing programs are focused on elementary or middle school. So we saw a gap in high
These
schoolers.
kids keep growing.
They do. I got a bunch of them, right? And so charity with dignity, they get $150 spending limit for going in, and they can choose the store they want to go to. We had a child that was like 6'5" and size 15 shoes.
Yeah.
You're not taking them to Target or
That
Walmart,
doesn't work.
right? You got to take them to the big and tall store,
Yep.
right? So they can choose the store they want to go to. But they pay $10, right? And that $10 is that parent's buy-in. So they feel like, look, I'm doing something. I'm stepping into this. I'm owning part of this role. You talk about having those case managers, right? Ours is Jules, and she's just amazing. They come in and they're meeting in an office in a privacy, right? And they're able to talk about, okay, today you're coming to me for clothes, but what's the bigger?
Yeah.
What are some other challenges in your life? Because usually one of those challenges is just a symptom of a bigger problem. And then we can get them plugged into other programs. Pathways to Prosperity being one that we host at the Kroc Center, where they can go through financial literacy courses, cooking courses, and different things like that. And so we take people one-on-one and we meet with them privately and we talk about, okay, this is a program you're approaching us for, but how else can we support you? How else can we wrap around? And I think in doing so, it allows these families to approach us with dignity and not to feel like they're just looking for a handout. There's some buy-in for them. There's some skin in the game for them. And I think that small change, not making everything free, but maybe there's a small buy-in, allows them to feel like they're participating in supporting their own family.
That's great. And I mean, I just love that word dignity, right? Like we all want it. And you never know when you're going to need help. Like I think having everybody kind of get over that stigma of asking for help. Like I know my family always laughs at me because like I might ask for help and if it's not there right now, I end up breaking my finger because I was trying to lift the fridge by myself or
We're men.
like goofy
We're
things,
men.
right? And it's just like, but being able to ask for help and, you know, have a resource, I mean, it saves lives. I mean, it really does. And I worry about the people that can't get over that. I was going to say it too prideful, but I don't want it to come across that way, but just we get stuck in our own heads that we can't ask for help and the world needs you. And be so sad if you weren't here because you didn't ask for help. And when we were talking with Rosa on the last episode, we were talking about just that situational awareness of just being aware of who might need a smile, who might need a hug around us, with whether they're kids or adults or people we're interacting with, smiling at somebody on the street. I mean, the world's already dark enough and challenging enough. Like we should just have that little extra light to share with everybody. And I think that's so prevalent at the Kroc. So you walk in and it feels different. And again, we talked about, we wanted it to feel like that at our site. We said, if it feels like a medical clinic, we failed in our design. Right. And I think, we tried to build a community center and it could have felt like a traditional YMCA. You walk in and it feels welcoming and warm and love and it's just peaceful there. And I think, that says so much about this community and, what everybody's trying to go for.
Well, it's certainly a culture we try to build and maintain. It starts with our onboarding process and the hiring process. And from day one, helping people that want to work with us understand who we are and who we serve. And so Kip and our associate director, center director, Stacy, they handle kind of this onboarding process. And they talk about the mission of the Salvation Army, our core values at the Kroc Center, instill that from day one. Because we do have all walks of life in our community, in our Kroc Center. You could be on the treadmill next to a millionaire, and then you got someone else that's on scholarship, or maybe they're on a prison release scholarship, something like that. We got people coming in for shower vouchers, and so you don't know who you're working out next to. But it's you put on some gym clothes, and it's a great equalizer.
It's all the community.
We're all together, so nobody knows if they're on a scholarship. We have people that pay a full rate, and then we have a 50% scholarship. That's kind of a dignity thing there to say, look, you don't need a full handout. And then the people that need 100% scholarship, there's wraparound services, so that maybe a year from now they're not in a position where they need a full scholarship. Now they're in a position where they've taken some financial literacy courses. We've come along and stabilized them, and now they don't need that full scholarship. And, it's there for them if they need it, but our goal is to move them forward. I think when people are in crisis, they don't always understand there is a way out.
Yeah.
They don't understand what resources are out there. They're just trying to put out fire to fire.
Yep.
How am I going to put food on the table tonight? What's the next thing? And so when we get the opportunity to serve and be inserted into their lives, we look at as a touch point. If you came to us for clothing, that's just a touch point. What else can we come alongside you? If you came to us for food or a voucher for housing or something like that, that's just one touch point, and we'll come alongside you. Obviously, the gym membership and working out is a huge part, and people don't underestimate the value of physical exercise. Right. But then being a community center, we say we're more than a fitness center, right? Because if we were just a fitness center, that wouldn't be that, right? To be able to plug people into different programming and services that kind of heal them holistically, mind, body, and spirit, is just a wonderful recipe for community impact.
Yeah, no, it's such a great resource. I love talking about leadership on this podcast when we have opportunities to talk with people. So you're in kind of a little distinct or different arrangement where you and your wife are executive directors together. I talk about how lonely it is oftentimes when you are a leader. That's got to be pretty incredible having your spouse that you can share and support all of the work. But how do both of you handle the stress of you're running an incredibly important organization? As directors, we all have to figure out how to make sure the bills get paid, that staff get paid, that the community knows us. There's a lot of pressure on these roles, and oftentimes it does feel lonely. What do you guys do to kind of keep your bucket full? You're obviously raising kids, and we have life and work and community, and they all kind of collide. As leaders, oftentimes we forget to ask for help sometimes too. But what's your advice to a leader that's struggling right now?
Sure. I'd say my wife and I had the luxury of working together in real estate for many years because working with spouses isn't always easy. But we got to learn how to work together, divide and conquer. I have strengths and she has strengths. I have weaknesses and she complements them. And so she owns her roles and I own my roles. Certainly there's a lot of pillow talk about the in-between. But I would really say it's our team of directors. So we have a team of directors, development of director Amy, Kip, our center director. He's been there 16 years. He's been there since the beginning. And then we have Stacy. She was the first hire in the entire Kroc system.
So
before they put a shovel in the ground, she was a part of it. And then we have Mike Nunemacher, our operations director, been there since day one. And these are just the most salt of the earth people that we could work with. And so we're stepping into something that's working really well. Kip, our center director, his big thing is leadership development and culture. And so we spend a lot of time developing our managers. We just launched a new learning module where people can take a leadership class once a month for an entire year. And then there's accountability to those classes. So continuing to pour into and develop our managers, knowing that one day they could be the directors. Kip wasn't the center director.
It's always the goal, right?
Yeah. Kip wasn't the center director day one, Bill, you mentioned, was there for a long period of time. So we know that if we can keep promoting from within the system, it's great. So I would say our directors are fantastic, and they take off a lot of that pressure. And
That's great.
If you can hire well,
build the team.
If you can build the team, you can do so much more, right? You can go fast alone, but you can go further as a team. And so having that supportive team that can really lean into the different facets of what we're doing allows my wife and I to continue to work on culture. We like to say that we're standing on the shoulders of the giants that went before us, right? So you've met the previous executive directors, and we're just standing on top of them. We're not coming in and trying to fix a broken system. We're taking what's good and saying what areas can we improve in. Allows us to step back and focus on culture and retention, looking at our employees, their overall work satisfaction. There's a survey we take each year. It's a best Christian place to work, and just a lot of those things, whether they're Christian or not, are positive in the workplace. You don't have to be a Christian to work at the Kroc Center. You don't have to be a Christian to work out there, right? But we're going to create an environment where people feel the love.
Yeah.
So I would attribute it to building the good team.
I love it.
And then keeping that team happy, right? What can I do to keep my directors happy?
Yep.
Because I'm sure there's always job offers that will come up along the way. But if they can feel like they're doing more than a job, it's more than a paycheck. If they understand they're a part of that recipe for community impact, then a bump in pay to go somewhere else is never going to be something that entices, right?
Yep.
People don't work at the Salvation Army because we pay the most, because we don't. We're a Christian nonprofit, and we're kind of capped on what we can pay. But then when they can see that they're a part of something bigger, it really keeps them grounded and keeps them feeling like, I want to be a part of something bigger. I want to be a part of an organization that is doing the most good. I want to be a part of an organization that is having community impact on a broader scale. And so continuing to tell that story within our own staff. We look at our staff as our primary ministry. If I can pour into my directors and pour into our managers, then they're going to be happy workers. When they're happy workers, they're going to have, they're the face to our members and the people that are coming through the Kroc Center. And so our goal is to continue to love on them and support them, give the resources they need, and create a culture and an environment for them to continue to grow themselves in professionally.
No, I mean, some of the most incredible people I've met have come, from the Kroc Center. We have to do a shout out to the amazing Harry Amond, right? Harry was a big part of developing the program, and my favorite memory, Harry's like, come out and let's sit on the back deck and talk for a minute. And, just being able to talk with people like that and have people like that in your life is so amazing. And I think it's embedded inside the organization and what you guys do, which is such a wonderful thing for the community.
Yeah. Outside of that, you got to stand on your convictions, right? If if there's a direction you want to take and you're prayed up and you know it's the right decision, sometimes you're going to be met with resistance, right? Change doesn't come overnight. And so if you know that you're on the right path, you got to stick to your convictions, and you can't cast vision once. You cast vision, but you have to continually recast it. And so it takes a lot to, shift an organization. We have about 250 employees. And so when you share a vision, you have to continually share it and get people to buy into it.
Yep.
Yeah.
It's kind of that job of a leader, right? Take people from point A to point B with clarity.
Yeah.
And in doing that, there's so many things that impact your ability to be clear, and the world shifts and you keep going. And I mean, for us, the Center for Healthy Living has been a dream we've been working on since we started with the Kroc RX program. I mean, that ignited something in us saying, wow, we can do this differently. And it works. And I mean, we're 10 years into this. We had phase 1 done last year, and phase 2 opens up in the fall. But it takes a lot of work to move an organization that direction. And then you see the impact of what these things do for the community, and how you can just bless people's lives as you perform your work and you do it well. You have staff that are there. I like to say job, career, calling. Yeah. Right. I mean, if you're just there for a job, you're going to be there for a job. Sure. Career's okay. Yeah. But I mean, the people that excel they're people there because it's a calling. And I mean, your team definitely represents that, and
100%.
have been so incredible for our community. Yeah. So good. As we start to kind of wrap up, what do you look at? So what does the future look like for the Kroc Center? What kind of things,
Sure.
What areas do you see yourselves looking at to focus on? And then how can the community, aside from being members, what do you need from the community? I mean, you guys are providing resources, doing a great thing. Yeah. We're all nonprofit organizations. What does that look like for the community to support you guys?
So we're leaning into some more internal programming. Our facility certainly gets used by a lot of great organizations, but I think we have the opportunity to leverage some of the talent that we have inside our walls. So one program we launched since we've been here is called Rock the Kroc, and it is a worship team development school. If you don't know what a worship team development school is, just think Rock the Kroc, like a School of Rock, Jack Black. And so we've launched a program internally. We've got about 45 students that are going through that. And so certainly there are other organizations doing music, but we felt that the arts are sometimes lacking, right? And so if we can lean into that arts with that wonderful facility we have, and so we have the opportunity, these kids have their first recital on March 25th.
That's so cool.
And then there's a regional competition where they get to go and showcase their skills out in Seattle, where they compete against other churches, and the winners of that will go travel down to Los Angeles. And so leaning into some of our youth programming, we do 11 weeks of summer day camp over the summer, which is fantastic. And we say, well, what other youth programming can we be doing internally? So we're looking at doing some of our own theater productions. We got that wonderful theater.
I love it.
And it's rented out 300 some odd days a year. But we say, what with the talent we have, let's put on some of our own theater productions. And so those are leaning into more of the youth offerings that we have, continuing to collaborate with the partners in the community. There's no shortage of what we can accomplish with the resources, at least facility-wise we have. Financial resources is kind of the one that always stops us.
Seems to be the rate limiting factor sometimes.
Yeah. I mean, we got a big, beautiful facility, but now it's, 16 years old. So we do our best.
16 years.
Yeah. We do our best to maintain it. But, it's as you can imagine, to the cleanliness and the fit and the finish that we have there. But it is a battle to keep it looking that way. And so leaning into that. I think in this, before the summer, we're going to have what we call a Heroes campaign. It might be titled something differently. But it's basically allowing the members to participate in a fundraising initiative to be able to continue to do the social work that we do, to be able to continue to offer maybe a discounted scholarship, to be able to continue to do third grade swim. And so when these little campaigns come up, it's not always the $1 million donation, right? It's the people that are willing to give $50 or $100, or it's the people that are willing to step in and volunteer to pack the food boxes that we get through our food drives. And so always looking at what opportunities we have coming up with volunteerism and those smaller giving campaigns. Certainly at Christmas, you'll see those red kettles at the grocery stores. You know, that money goes straight
Get
back
really
in.
strong.
Oh, yeah.
Ringing that bell.
Well, people, you put $1 in that kettle, that dollar is going right back into the community. You know, our membership dues and endowments that we have from our initial setup, they cover the maintenance of our facility. And so each year we raise about $1 million, and that $1 million goes right back into the social service programs that we do. That's how we're putting clothing on children's backs. And so during Christmas time, you see a kettle, you know, maybe volunteer to ring a kettle. And if you don't have the time to volunteer bell ring, then you consider making a small donation there, knowing that everything that's raised local stays local.
And I love that. I love how other organizations in the community have just embraced that and turned it into competitions. I know the chambers do it and Rotary clubs, everybody, you know, trying to engage in it. And then, you know, every time you go to, for me, it's Fred Meyer. And like, if you don't have cash on you when you walk by, you're like, I got to get cash out. You have that guilt as you walk by if you don't have it at the time. But it's just, you know, that real reminder of this is how we care for our community. And, you know, a couple extra dollars here and there, participating in, you know, fundraising projects, being a member, supporting it. I mean, this is how we have nice things for our community. And it takes a village. It takes us all working together to make that stuff happen.
Absolutely.
So, that's good. Is there anything else you want to cover before we kind of wrap it up here?
I just want to say maybe a big thank you to the community. We wouldn't be here without your support. I think coming to this community was the largest capital campaign this community had seen up until that point. And so they stepped in when we were built, and they've stepped in every step of the way. So we appreciate the community support and all the community partners that come alongside us. We're always open to new ventures, and we love being creative. If there's a gap in the community, we want to be a part of the solution. We don't want to duplicate what other people are doing. We want to step into unmet needs. And so if there are unmet needs in the community that you're aware of, we want to be aware of them. We want to be a part of that solution, whether it's us filling that gap or whether it's us partnering with other companies. We have, I think, the resources and the talent to continue to make our community better. And I think this community center, we like to call it town hall. It's like almost it's the town hall square. You see our parking lot; it's always full, but people are coming here for hope, and so we appreciate the continued support of the community. We certainly couldn't do it without our community support.
Oh, I love that. I mean, we are so lucky to live in this community, and it continues to step up and support projects that this community needs. And I mean, it's amazing. And I wish that is the stuff that was highlighted more. You know, I think if you're on social media, it's really easy to look at it and go, this world is falling apart and it's all darkness and terrible and everybody hates each other. And then you go to the grocery store and it's like, I actually don't think I've ever seen anyone fight somebody at the grocery store for who they voted for. Yeah. Maybe they want to fight over the last banana, who knows? But there's nothing but just support and love and joy as you interact with people in the community. And I wish that was the thing that people would latch on to. Like, the other stuff is designed to kind of pull us away and kind of bring us into that darkness. But when you spend time at the Kroc Center, you feel nothing but love and joy and support and just a connection to something bigger than yourself. And I thank you for being here in our community. Thank you to your wife and your kids and making that shift. It is always a sacrifice to move to a new place and dedicate your life to making change. Mm. And I can't wait to see all of the amazing things that you and your family do for this community while you're in service here in Coeur d'Alene. So thank you for being here, and I'm looking forward to working with you guys on lots of projects coming up as well. That's how we do this. Exactly. That's how we make this happen in our community. And we're so blessed. So thank you for being here.
Yeah, thanks for having me on.
All right. Well, thank you all for being here today. I hope you've enjoyed this episode. If you would like to learn more about the Kroc Center here, there will be information in the show notes. We're so grateful for the work that they do. It's just something magic about being there. So if you haven't been there, go check it out. They love giving tours. I mean, it is something really special. Thank you for being here this week. We'll see you again next week.